to the Technical Assistance Network for Children's Behavioral Health, Cultural and Linguistic Competence Peer Learning Exchange. The Peer Learning Exchange is a webinar or monthly call with topics focusing on culture, health equity, and disparities in children's behavioral health. Topics are generated by you, individuals working in or being served by behavioral health organizations and partnering with system of care states and communities. This webinar is part of the Cultural and Linguistic Competency Learning Community for the TA Network. TA Network, as it is known, is the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. Today's webinar is titled, Building Health Equity in Systems of Care by Engaging Diverse Families, Youth, and Community Organizations. This webinar will focus on practical strategies for engaging diverse families and youth in culturally and linguistically appropriate ways. Topics covered include opening doors through language assistance, outreach, and relationship building, establishing trust and creating a welcoming environment that attracts culturally diverse people and enhances behavioral health equity. My name is Catalina Booth, and I am the Executive Director of the Center for Community Learning. The Center for Community Learning is focused on providing training, technical assistance, research, and program evaluation on issues affecting diverse and traditionally underserved communities. As a partner in the TA Network, we provide technical assistance in the area of cultural and linguistic competence. In addition, you will hear from Linda Callejas. Linda is a research assistant professor in the Department of Child and Family Studies of the University of South Florida. She is the lead for the CLC team for the TA Network. You will also hear from Rocio Tucen. She is part of the Federation of Families Miami-Dade chapter, and she is a certified peer specialist. She will be followed by Taylor Blanco, who is a youth program supervisor for the OCP2 System of Care grant in Broward County, Florida. And finally, you will hear from Daniela Dominguez, who serves as a community education coordinator for the YES Institute. And a bit of housekeeping. This presentation is being recorded, and your lines will be muted right now to help eliminate background noise. So feel free to use the chat box to type in any questions or comments during the presentation. Following our presentation, we'll open the lines for further questions and discussion. And at the end, please stay on the line as there will be a brief survey that you can click on and complete. So without further ado, let's get started with our first presenter, Linda Callejas.
Thanks, Catalina. Great. So as a first step in framing the discussion for today's peer exchange, I'll start with a quick overview of a model of cultural competence that emphasizes organizational strategies designed to reduce behavioral health disparities. The conceptual model on this slide is one that my colleagues at the University of South Florida and I developed and have done quite a bit of research with to better understand how organizations and systems as a whole can work to improve service delivery for all populations, particularly those that are underserved and experience disparities. This model focuses on cultural and linguistic competence from an implementation perspective and highlights all of the factors that shape how services are made available for and accessed and used by culturally diverse populations. And we use this model as a basis for a lot of the technical assistance, if not all the technical assistance that we provide related to culturally and linguistically competent service delivery. So very generally speaking, the model shows that our child-serving systems and organizations are situated within communities that they share with the populations that they serve or intend to serve. And this is symbolized by the rectangle labeled community context. And the community context includes all of the factors such as funding, policies at a variety of levels, as well as change and movement of populations within a given neighborhood or community in which we're all situated, right? And further, the model emphasizes compatibility, symbolized by the red arrows and portions on the slide, and these symbolize all of the ways, the strategies that organizations use to understand the needs and the strengths of the populations they're charged with serving, and more importantly, how they can use what they learn, that information about needs and strengths, to improve service delivery and ultimately reduce disparities. So I won't go into a great deal more about the model except to say that because we understand our communities to be dynamic and ever-changing, the work of culturally and linguistically appropriate service delivery is ongoing, and it always should have as a primary external focus compatibility with our populations of focus, right? And that is the youth, young adults, children, and families that behavioral health organizations, and systems serve. Okay, sorry about that. The next slide highlights the organizational elements that support culturally competent service delivery. And as you can see in the left-hand triangle, this model presupposes that just about every aspect of an organization must be involved in order to support increased access, availability, and utilization of services, including efforts to reach out to the populations that we serve, which we're discussing today. And so the intentional incorporation of strategies in all of these areas is thought to improve outcomes for children, youth, and young adults involved in our service systems. So one quick example to make this more concrete is that if we focus on building compatibility with the populations that we serve, and engagement of these populations is one key strategy that we're going to be using. We can't do a good enough job with that engagement if our organizational leadership, for instance, isn't on board with whatever activity we'll be doing with the community, if they don't value the strategy, or if there are organizational policies in place that don't allow for staff members to work in communities or to, make those relationships more real. And if another example, if data isn't collected to understand what community assets and needs are, then we won't have the information we need to better shape the development, implementation, and evaluation of our services. So the actual engagement part of this effort, while that's done by key folks within an organization, those efforts are supported by all of the aspects of an organization. All of the infrastructure of an organization should be working together in order to make sure that this one strategy works well and continues to do so over time. So, and I just want to point out before I move to the next slide that community and service user participation we identify as a key part of an organization's infrastructure that should be explicitly addressed and put into place and recognized by the entire organization as a key focus. So as we begin the process of working directly with communities to engage in our services, the questions listed here are vitally important for organizations to really think about and be able to respond to in a meaningful way. As you can see, they require real work on the part of service providers and systems to gather information that helps build a deeper understanding of populations of focus, and then again use that information to shape not just our engagement efforts, but then our subsequent service delivery practices. And as you can see, I won't go through all of the questions, but other questions that should be on here are: what is the primary language that the population that we intend to serve feels most comfortable with regards to their health and their health beliefs? And really understanding that relationship that different populations may have with our organizations and service systems can give us some insights about how better to work with them as we continue trying to engage. So just a brief note here that before we launch into engagement, which we have listed here a CDC definition of the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. It's also important to do outreach, right, and to get out into these neighborhoods and communities, get to know the people that we serve, and to really work toward having meaningful, active representation on our organizational and system committees, and participation in that process of designing our services in the design, implementation, and evaluation of services and programs whenever possible, and especially from the beginning, that effort be one that is very intentional and that it become a core part of the organization or system. So I'm going to end my brief introduction here and turn it back to Catalina.
Thank you, Linda. The framework she presented highlights the importance of community outreach and engagement to cultural and linguistic competence. Both are vital to establishing an organization and program that is compatible with the strengths and needs of the community it serves. When we ensure cultural and linguistic competence in this way, disparities are reduced and health equity is improved because availability, access, and utilization improve. The question for all of us here is how we actually put that into practice. How do we better reach out and engage the diverse populations that we serve in our community? So in this next section, we will hear from Rocio Toussaint, and she's a certified peer specialist who works for the Federation of Families in Miami-Dade. But before we hear from her directly, we're going to take a video tour of the Family Center, and then we will hear from Rocio on how they use the center and its programs to engage diverse families and youth. We call this section Opening Doors because Rocio and her team are an excellent example of how to reach out to diverse families and youth in a way that honors their cultural strengths. So if you could play the first video for us.
Welcome to the Federation of Families Youth and Family Center, where we have fun activities like canvas painting, Zumba classes, and celebrate all cultures and ethnicities by celebrating their foods, customs, and traditions. I enjoy coming to the Youth and Family Center because it is an open space where I can connect with others who are like me and learn from peers who challenge me to be better than I am. Through the different art forms like painting and dancing, I have learned the importance of self-expression and voice through one's creativity. This tool of self-expression has taught me how unique and needed my point of view is and how vital self-advocacy is for me and those around me. The center has taught me the importance of self-care and offers a variety of stress relief techniques like guided meditation, breathwork, and support groups. I feel the most at home in the center because I am able to express myself in Spanish and English. Being a Dominican American, I find myself being split between two worlds, yet at the center I am able to feel at home and express my Latino roots.
Hola, mi nombre es Rocio Toussaint y soy una especialista de padres certificada por el estado de la Florida y trabajo en la Federación de Familias, capítulo de Miami-Dade, como especialista en enganche comunitario.
My name is Rocio Toussaint. I am a peer specialist certified by the state of Florida and work as a community engagement specialist for the Federation of Families in the Miami-Dade chapter.
Creemos que el elemento más importante para establecer relaciones con personas difíciles de enganchar es la comunicación, especialmente el idioma. Es por eso que estamos haciendo esta parte de la presentación usando un intérprete.
We believe the most important element in establishing relationships with people who are difficult to engage with is the element of communication, specifically language. This is why we are doing this part of the presentation using an interpreter.
Cuando usamos un mismo idioma nos sentimos cercanos y unidos por nuestra lengua, valores y sentido de hispanidad. Cuando usamos nuestro idioma base, nos sentimos unidos porque nos recuerda nuestras raíces, valores y costumbres, reforzando así nuestra hispanidad.
When we use the same language, we feel closer and united by our language, values, and sense of belonging to the Hispanic community. When we use our native language, we feel united because it reminds us of our roots, values, and customs, reinforcing our Hispanic identity. In order to build relationships and establish trust with hard-to-engage communities, it is very important that communication be effective and able to eliminate language barriers with the use of interpreters. People with limited English proficiency prefer that when someone addresses them, it is in their own language to avoid any confusion.
Una buena relación con nuestros participantes comienza desde el momento en que iniciamos la promoción o alcance comunitario.
A good relationship with our participants starts from the moment we start the promotion and community outreach.
Promoción no es simplemente entregar un volante o flyer, puesto que muchas veces no se interesan por su contenido, dado que están atravesando alguna situación adversa, como pudiera ser un diagnóstico de una enfermedad mental o uso de sustancia, además algún asunto familiar, problemas financieros, problemas de inmigración o adaptación a este mismo país, etc.
Promotion is not simply delivering a flyer. Many times people are not interested in the flyer's content, given that they are going through adverse...
We're going to transition back to the slide, and we'll continue in a second. And just to summarize what we've heard in the video, I think the key takeaway from Rocio's presentation about how to open doors are 6 of these. There's first, communicate in native language. People feel more comfortable. 2, build relationships and get to know people on a personal level. 3, establish trust. 4, show a welcoming attitude and behavior. 5, create opportunities to gather and connect. 6, include non-traditional community resources. So one thing she said that really stuck in my head was that promotion is more than a flyer, that when we want to do outreach, it's more than just giving a flyer. It's creating a connection with people. And the tour of the center presented some examples of how well to do that. In fact, Andy Wessel from the Douglas County Health Department in Nebraska explains, creating time over food and drink to deepen relationships, sharing about our families, the values we have in common, our regular lives is critically important for building the trust and understanding that allow us to stick together while doing challenging work. So now that we have, sorry, I'm trying to get my mouse to cooperate with me. Here we go. Now that we've talked about how to open doors, our next presenter, Taylor Blanco, is going to talk about building relationships with and communication with youth. As I explained before, Taylor is a youth program supervisor at OCP2 System of Care in Broward County. And I turn it over to you, Taylor.
Thank you, and good afternoon, everybody. As was said, I work with the OCP2 Community Partnership Grant, and I also work under a nonprofit called South Florida Wellness Network, and I help facilitate a chapter called Youth Move Broward. Just to tell you a little bit about Youth Move Broward, it's actually part of a national organization called Youth Move, and there's actually multiple chapters throughout the United States, including one in the Family Center that Rocio works in. There's a Youth Move Miami-Dade down there. So we've got representation all over the United States. But just to get into a little bit about what we do as a chapter, one of the really big things, as we've been discussing in this webinar, is building that rapport and trust with youth. You know, so it's giving them that incentive or that buy-in to get involved in everything that we're doing, because a lot of the youth that come into our programs, they've had so many people come in and out of their life. They've had case managers, they've maybe had different guardians, different situations. And so really building that trust with them and letting them know that we're going to be here for the long run and we're here to support them through whatever process they're in is really important, and that our ultimate goal is to see them thrive and to give them hope, and that, they can become independent and live the life that they want to live and accomplish their dreams and everything that, they may have felt they couldn't do because of a substance use issue or a mental health issue. So a lot of the workshops that we do different kinds of workshops, but one kind that we do is arts and crafts workshops. So that's a really good way just to get youth engaged in a fun activity. Nothing serious. We're not talking leadership or anything like that. We're just asking youth to come, drop in, use some of their creative juices, express themselves, whatever they may be going through at the moment. So as you can see here, there's a picture of a flyer, and it says Beat the Odds. So that's actually a drumming workshop that we do where we help youth build those social and emotional skills. We help them express themselves. We help them, find empathy by listening to others and playing in unison together, playing beats, whatever kind of, energy or nervous energy they have built up inside of them. They can express it on the drums. Another thing that we do is dancing mindfulness. So this is another kind of mindfulness practice where, again, it's expression through arts and teaching them mindfulness and being present in the moment and being aware of whatever's going on in their body at that time and exploring different things that come up. There may be some body issues, maybe some, fear of judgment, different things, and we can work through that. Another flyer you'll see on here, it says Vibes, and that's just a workshop where youth just come and just hang out. We've had, video games, we've had board games, we've, done line dancing, literally anything that they want to do just to come and connect with other young people. That's kind of, what that's all about, and it's a good way to get to know some youth on a more deeper level, and not only that, but it gives them the opportunity to form friendships amongst themselves, because it's one thing to tell someone, oh, come to a workshop, but if they don't know anybody, it's kind of hard, to get them through that first barrier. But when they actually, build those relationships with the other youth, they kind of have that buy-in or that incentive to keep coming back because they have a group of friends. And then the last flyer you'll see here, it says Face the Music, and that was actually a really popular workshop that we did where youth were able to create songs, create raps, beats, spoken word, even dance, any kind of performance that helped them express themselves. One thing that I've come to find working with youth is that it's kind of hard to get them to just, come out and tell their story and tell, a group of strangers all these things that have happened to them, and maybe some of these things they haven't even told their parents, let alone, complete strangers. So this is kind of an outlet for them to tell their story in a more creative way where, we're not asking them to get up on a podium and just divulge everything, but maybe say it in a rap or, a song or a poem. So these are things that really, help youth kind of get out of their comfort zone, but at the same time, it's still comfortable for them in a way that, makes sense to them. And aside from, the arts and crafts stuff and, the different creative expression workshops, we also do a lot of life skills workshops. So we understand that transitioning into adulthood can be very hard, and there's a lot of struggles that come with that. So when I'm creating workshops and when I'm getting together with youth in meetings, I'm asking them, what are some things that you would like to know about, or stuff that school is not teaching you right now? And sometimes I even think about things that I wish I would have known at a certain age, and I kind of come up with those workshops with them. So, stuff like mock job interviews, resume building, financial literacy, cooking workshops, emotional regulation, mental health education, what does healthy relationships look like, talk about harm reduction and drug awareness, stuff like that they might not be learning in school, and, you know, it's a good way to help support them in not only their mental wellness, but all the other aspects that keeps you well. And next, I want to talk about giving youth leadership opportunities. And I think this is probably one of the most important parts of getting youth engaged with Youth Move. Of course, you know, we get them engaged through all the different workshops, but we also have a monthly leadership meeting that we get together and we talk about different issues going on in the community. And the youth that are involved, we give them opportunity to step up and to, you know, become the president of the chapter, become the vice president, secretary. We encourage them to start their own committees and, you know, get involved on a more leadership level, because everything that we do is all strength-based. A lot of times when, you know, youth get referred to us, maybe their parents, maybe their case managers have been telling them, well, you know, this is what's wrong with you and this is what's going wrong and everything's not working. And we're here to say, well, what's going right? You know, what are we doing that is going to focus on their strengths so that we're not focusing on the negative all the time? You know, are they good at social marketing? Are they good at public speaking? Are they good at graphic design? Whatever it is, we engage with youth and ask them these things. We ask them what they're good at. We find out ways to help them get involved on a bigger level. We invite them to come to these working meetings with us where there's stakeholders at the table, you know, big funders. We ask them to come and participate in focus groups with other providers in our provider network that are wondering, you know, what is services looking like for youth? Are they working? Are they not working? What can we do better? So these are some things that we get them involved in, and not only that, but advocacy on a much larger scale. At the end of the day, you know, we know that policy change can affect so many different things. And so we get them involved on that level where we ask them, you know, what is it that we can do to bring to, you know, the Capitol? What can we talk to them about? What can we tell them that we want to change with services? So essentially the whole point is to build them up, to get them to that level where they build confidence in themselves and they feel like they have a purpose and they're part of something and they have a reason to, whether maybe that's the only reason why they want to get up in the morning, but it's something. And then I want to talk a little bit about communication via social media. This has been a really big thing for me for reaching some youth that may not physically be able to come to any of the workshops or any of the meetings. I recognize the power of, you know, social media and being able to reach different populations. So just to talk about some of the platforms that I use, you'll see a little cloud in a blue box in the corner. That is actually called Remind 101, and I came across this app through a youth who was actually coming to our group, and she said that teachers in schools were actually using this app to communicate with their students. So I started using it to blast out different leadership opportunities, different workshop opportunities, even engaging youth that I would meet, you know, at vendor fairs, going to, you know, different places that I come across different young people that I feel would benefit from our program. I add them to our text blast, and they get all of our events, everything that's going on, and that's been a really great way to keep people engaged and to keep people coming back. And then, of course, I'm sure you guys recognize the little Instagram logo, the Snapchat logo, and the Facebook logo. So through those platforms, I'm constantly posting, you know, motivational pictures, motivational quotes, illustrations, things that youth can relate with, that talk about different issues with mental health, with relationships, stuff like that, that, you know, they can get little tidbits on a day-to-day basis, whether I'm interacting with them directly or indirectly. They're still sort of receiving, you know, positive messages from me that can keep them going throughout the day and, you know, give them a little bit of education. And I've had youth come up to me. They're like, hey, I saw what you posted the other day, and that was just so awesome. Like, I related with that so much. So I know that those things are making positive impact. And then with Snapchat, we like to record, you know, different events that maybe some youth have missed out on. If they can't show up to a workshop or a leadership meeting, we'll record some of what's going on there. And they can still kind of tune in through there. So like I said, these platforms have been amazing in keeping the chapter going and keeping, you know, those people that don't have a ride or don't have a bus pass or can't take an Uber, but they still want to tune in from home. And then lastly, this is just a little slide to keep us connected. So if you guys want to stay connected with Youth Move Broward, we have our Instagram page. It's YouthMove_Broward. We have our Snapchat. It's YM Broward. And if you want to find us on Facebook, you can type in Youth Move Broward, and you will find everything that we are doing. So I hope to meet some of you guys, and I hope to hear from some of you. Thank you.
Thank you, Taylor. That was an excellent presentation on a way to communicate and to establish relationships and to deepen those relationships. So far, the common theme with all our speakers has been the need to establish trust and engage in meaningful personal conversations, and then also to maintain that open line of communication. Therefore, our last speaker, Daniela Dominguez, will share ways of engaging youth and families in meaningful and personal conversations. They will focus on conversation about gender and orientation, but the model they will present is really helpful for any type of meaningful conversation. With that, I turn it over to you, Daniela.
Hi, everyone. You can call me Danny. My pronouns are they, them. Please ask a question about that if you're confused around that. So I do want to start with, can everybody hear me?
Yes.
Okay, I do want to start with that this is not in any way, shape, or form aimed to challenge your beliefs or to get you to let go of your most valued beliefs. It's really just an option on how to provide the best quality service. And so the Yes Institute is a nonprofit. We're based out of Florida, but we work everywhere, even in different countries. Our vision is creating a community where all youth are free of suicide, violence, and discrimination. And we do that through powerful communication and education on gender and orientation. That means having dialogues with families, parents, community organizations, hospitals, schools, really all across different communities. Okay, so if you have, please feel free to ask any questions in the chat box or anything. There's nothing I haven't heard before, so please feel safe to do that. I'll just go through a few statistics here. You know, as we know, youth who identify as lesbian, gay, bisexual, and transgender are 3 to 4 times more likely to either attempt suicide or contemplate suicide and self-harm, at higher risk of bringing a weapon to school, higher risk of engaging in substance use. And as you can see the last number, 60% of trans youth are more likely to attempt suicide with unsupportive parents. Now, this is not in any way, shape, or form trying to make parents wrong, but it does have us ask the question, you know, what is going on? How can we prevent these numbers from getting even higher and from getting there in the first place? That's where we think that dialogue and conversation is really important when it comes to our community. And so what you see here is what's called the binary. So traditionally speaking, we think of as body, gender, and orientation as only 2 options. And while those are our expectations and traditional notions, realistically, on our human experiences, they're not the case. So, and one way you can engage youth and families is by getting away from binary language and assumptions. You know, seeing a young person that may dress different than your expectation, being really careful about how you engage that person. Parents, what we're starting to see now is more and more labels that youth are taking on to describe their experiences around gender, around orientation. You have terms like transgender, non-binary, androgynous, and the list really goes on. So how do you really keep up, and how do you make sure that you are addressing and relating to people the best way possible? So one thing for sure is to ask. If you don't know, ask. What's your name? What pronouns do you use? What's your preferred name? If someone says they use a different pronoun other than she and he, and you're not used to that, just say, sorry, I'm getting used to this, and move on. But really the best thing that you can do is acknowledge someone's name and pronoun. When you're talking about, people often get the question like, do you have a boyfriend or do you have a girlfriend? Getting away from that binary language and those assumptions, asking, instead, do you have a significant other? So this is where intake forms will really play a key part in whether people feel safe to go to you and safe in your organization and your community space. Same thing with parents. A lot of forms say mom and dad. You want to consider, are you using binary language, right? Is this inclusive of everyone? What if you could put parent 1 and parent 2 to really make sure that you encompass that community? Oftentimes having a space in an intake form that says, please write in what your experience around gender is. That way you don't have to put it into a box, but you let people themselves write in what their experience is. Same thing with orientation. There's over 200 labels right now, and it gets pretty confusing to keep up. So having a space where the young person or the adult can write in what their experience is probably even better. If you come across a term or a label that you're not sure of, just ask them. Even if you've heard it before, what does that label mean for you? If you've never met anyone that's gone through gender transition, again, just apologize. And just on the note, say, I'm confused, I haven't heard this before. Be authentic. It doesn't mean you have to hide what you're actually going through. Be authentic and keep saying things like, I apologize, this is new to me, but I want to make sure that I see you. And that's the most important thing you could do. As someone who uses they pronouns and doesn't have a traditional experience around gender, it's really, it's awesome when someone just is authentic with me and says, you know what, I've never heard that before, but I want to learn. And that's where we come from, just in the state of just wanting to know and being inclusive of everyone. So in the conversation about being inclusive, I'm sure all of you have seen, if not all of this acronym, some of those letters. And again, like I said, there's over 200 different labels that people are now using to communicate their experiences. Here at Yes Institute and when I speak to families, especially families who are religious, families who have never had this conversation before, and older folks, I tend to stay away from the acronym because it confuses people and it doesn't really capture everybody. So we use gender and orientation to really create an everyone conversation, not an us versus them. There may be some people who may not see themselves on that acronym, people who, don't understand what the acronym means. So, and it's not to say that these labels aren't important. They are a lifeline to a lot of individuals, and it's not like saying get away with that labels. It's just a different option on how you can relate to someone who's not particularly comfortable with this topic, is new to this conversation, or is struggling with a young person identifying in every which way. So again, the acronym tends to kind of leave people out. There's over 7 billion people on the planet. There's new labels every single day. I do dialogues and trainings with young people. Every day I learn a new label. So it's just really about making sure that we are including everyone, even people who see themselves outside of this conversation. People, when using gender and orientation, it makes it really easy to work in communities of faith. Again, work with families who at first may not want to have this conversation, who believe that being gay is a sin and all of that. One thing that we're proud to say is that we can work with all communities, regardless of their point of view on this conversation, because we use language that they can see themselves into. And so this model of communication that we use Again, like I said, it includes all of us. There's a common purpose. Our purpose is keeping you safe, preventing suicide. Everyone can get behind that, even parents who disagree on this conversation. It's just about building bridges and seeing everyone as your partner. This model of communication can not only be in use when talking about gender and orientation, but it can really be used for anything. And lastly, I'm here to help. My contact information is on the slide. I welcome any questions, emails, phone calls, all of that. Thank you.
Thank you, Danny. I'm going to go back to one of her slides, the model of communication. I think the key part about what Danny shared was this model of communication, because it is a model of communication that works for not just gender and orientation, but about any topic or any situation that we might deal with, whether it be immigration status, whether it be language spoken, whether it be trauma experience. Using this model of communication is what bridges gaps and what opens doors and keeps them open and builds the relationships of trust that allow people to truly become engaged. When they're truly engaged and they feel listened to, that's when we make progress. So I'm going to speed through the lessons learned so that we can leave the last 10 minutes for questions. But the 4 key points of today's presentation are that we need to remember that community outreach and engagement are key components of cultural linguistic competence. It's so very important to combine and really work hand in hand between your social marketing and your cultural linguistic competence. They shouldn't be apart. They're one and the same. And when you really do something more than just create a flyer, but really engage people where they're at and in the ways that speak to them, that's when you're going to move forward. Outreach and engagements do not end with the flyer. As we saw from Rocio's example, whether it's providing dinners or drumming classes, or as Taylor explained, arts and crafts, all of those things are what will engage people. The third point we learned about today is reaching people where they are in the ways that matter to them. As Rocio pointed out, speak the language that matters to them. They may seem to you like to be comfortable in English and able to speak English, but their language of preference may be Spanish, it may be Creole, it may be something else. So just as you ask about gender and orientation, have the conversation about language. Last but not least, create a sense of family. Make sure that you have a friendly and welcoming atmosphere and provide opportunities to gather. I think those are key points, and we will be sending you a resource about some other ideas on how to create a sense of family. And I want to open the line for questioning. I know some people are having issues with the sound cutting in and out. And yes, the copy of the slides are provided down below. Down below the chat box is a file, and under there, the biggest file there, that's the one that has the slides, I believe, or one of those has it. Engaging Diverse Youth, the last one, that's got the slides. You will also receive an email with a link to the video, so you will be able to rewatch it, and you can download the slides. Tiara, you're going to unmute their phones, and we'll start taking questions in these last 10 minutes. And please be aware that Rocio's on the line and Miriam is on the line too. So in addition to the presenters, we have other people who have worked in diverse communities if you have some questions that you would like to ask. If you have questions, I think we may not be able to unmute everyone's phones because of the large number of attendees. If you would like to ask questions, please type them. We're looking at the chat box. And I will, it's going to take a few minutes for your questions to come through. I know there's 2 of you so far typing questions. So if you can bear with us, we'll get your questions. Oh, maybe not. And Patricia shared that she just wanted to say thank you for an amazing presentation. I found all the information useful, and I'm excited to integrate into the work we do. Thank you, Patricia. And a shameless, not a shameless plug, but another resource we will be emailing you about is we have, as part of the TA network, what's called our CLC and Behavioral Health Roundtable. And that meets once a month, and it's folks who work in the field of CLC and behavioral health equity, and we talk more about the nitty-gritty of implementing these sorts of programs and resources. So we'll get you all information on that. If you have any other questions, please type them in the chat box so we can get them answered. And if we miss your ability, there's a survey. Please, as we finish up, please click on that survey that's in the chat box. And if for some reason we miss your question, you will our emails are in the last slide of the presentation. Please reach out to any of us, and you'll also be getting an email from Tiara with everybody. And if any of you are interested in that CLC roundtable, I'm going to put my email in the chat box. Email me, and I will send you a meeting invite. Our next roundtable will be at the end of this month, and it'll be led by Selena Webster-Bass, and we're going to be talking about addressing bias in systems of care. We have a couple more people typing, so let's see if we have more questions. Oh, there is another slide. She's correct. As we get some questions, I forgot about our last slide, which I shouldn't have, is why it matters. Why do we want to engage people? Why do we want to open doors? Well, because engagement and empowerment reduce disparities in health equity. As the compatibility between services and the cultural context of community improves, and the organization responds to the cultural needs of its community of service it serves, access and utilization improve. So we talk about these things because they are important, and they are one of the key methods of reducing disparities in health equity. Okay, so Patricia has a question. In regards to using social media as a mode of communication, when you have videos of the youth activities, do you need youth to sign media forms in order to post picture videos of them? So yeah, do you have experience with that? Or Miriam?
Yeah, no, Taylor is answering.
Okay.
Taylor.
Yes. Our sign-in sheets ask people to check off a box whether or not they consent to being filmed or photographed.
Yeah.
And that's go ahead.
No, that's something that we do on a regular basis on all the programs that I have been. Very upfront, and there are few cases that, especially when it's family members, because violence, so the people will get in some part of the room where the video doesn't get to them.
Thank you for that question. We have a few more minutes left if there's any additional questions. Thank you for putting that up there. There's a link now in the chat box to the CLC team has a YouTube channel. The TA Network has a YouTube channel, and we have a playlist of CLC videos that range on a variety of different topics, a lot of the topics, and then there's also a social media channel for those of you who need more information on social media. Okay. If we have no more questions, just a reminder to take the survey. We can close out the meeting, and then everyone in a minute or so, here's our contact information. You have it in the presentation, and you can click on any of those right now. The link should work. Thank you. It was an enjoyable webinar because there was some familiar faces, but a lot of new faces, names. And it's always good to know that we are reaching a wide variety of people. I know we have people from all over the country and in different types of organizations, from public health administrators to systems of care to small organizations. So that's always good to know. Now we have one more person typing. I want to make sure we don't have a last-minute question, and then we can close it out. Oh, it was just a thank you. Thank you, everyone. So please take the survey, and then you're free to go after you've taken the survey.